Recorded.
My name is Kay Johnson, and with Maxine Hayes, I co-chair the InCK National Advisory Team. And you're going to be hearing from Maxine as well as from Charles Bruner, who is the National Resource Network Manager. You will be learning more about InCK as we go through today, but really learning about making the case for child health transformation. And I want to note that we're welcoming participants from Haifa, Israel today. We hope that you learn from us, and we hope you'll email us with some ideas you have about child health transformation. And I believe there's also an individual participating from Delhi. So we are actually having a little bit of an international scene here today, but we know what a busy time this is, and we appreciate you participating. With no further ado, I'm going to turn this over to Maxine to welcome and begin the webinar.
Well, thank you so much, Kay. And let me just say, welcome to first timers and welcome back to people who have been engaged with us with this conversation before. This is the first of a series of webinars, and I'd like to encourage you to be sure to tune in for the remainder. This is going to be an overview of what is yet to come. Transformation is the word. Want to underscore it. Transformation to what? And that is to be more preventive, to be more developmental and ecological in our interactions with early childhood health issues and families. So I want to just say now that I'm certain that all of us are experiencing right now what transformation can mean and feel like in response to COVID-19. We are transforming the way we work, doing our work from home, and how we also school our children. Schools are closed and children are learning at home. And we're using the internet as a tool, and how we are caring for our families. You know, families depend a lot on community. And in my community, with schools being closed, I'm very pleased to know that that our schools transformed in their thinking to make sure that children don't go hungry during the day. Some children come to school and they get breakfast, they get lunch, and they get snacks. And our educators have transformed transporting students to now transporting food. And the bus stops are distribution places that families can have breakfast, lunch, and snacks for their kids. So this is a good example of how we know how to transform ourselves to be more responsive. And the next slide says it all. If I could have the next slide.
Yes, just a moment. I seem to have lost my screen there. Hold on. Sorry, my apologies. It is back.
Oh, here it is. This slide says everything. I love to look at it because it's the vision that we all have for all of our children. And this vision of child health goes far beyond the physical, the mental, the intellectual, the social and emotional well-being, and not just the absence of disease. And, you know, we can have this picture for all children if we recognize that healthy children, our healthiest ones, live in healthy communities. They live in healthy families. They have environments that provide them with the opportunity to reach their full potential. This is our vision. And just keep that picture in mind as we continue to talk about transforming child health care to be more preventive, developmental, and ecological. Next slide. Now, for those of you not familiar with InCK, I think it's important to understand what our mission and agenda is all about. And it's simple. we have three goals. And the first is to support leaders like yourself in the field, to provide them with the tools to advance child health care transformation. And I want to shout out to Robert Wood Johnson, because Robert Wood Johnson has a vision and an initiative on building a culture of health. And so we're taking that culture of health framework and focusing it specifically on child health practitioners and their role in being the really the first responders, and working with families from the start to identify issues of which we can support them in their parenting role. And we want to produce and disseminate the state-of-the-art resources based on our overarching child health transformation framework developed by the National Advisory Team. And you can see members of the team there. And we want to advance this work in promoting child health transformation. I want to tell you that the role of the healthcare professionals is really crucial. I think about the COVID-19. In my community, the first responders was the fire department. It was that fire department in Kirkland, Washington, that noticed that, you know, something was going on in that nursing home that needed the attention of the community. In fact, they were the ones to connect public health to the fact that there was a disruption in what was a normal trend. But this was really what gave us the first sign that we need to do something. Well, the same is true of child health practitioners. They're really in a position to be assessing and finding the needs that we need to support our children and their families in. Right now, you know, social distancing is very demanding, and it is increasing the isolation and the stress of our families. And we need to be there to support them through this. That's just an example. Next slide, please. And we are not doing this by ourselves. We have a lot of partners, and this is just a picture of who and how many are sharing this vision with us. And these are resources that we want to connect all communities with. Next slide. Transformation is just absolutely necessary in achieving equity, and that is in achieving the opportunity for every child to reach their full potential. But the statistics are very sobering. Too many of our young children don't have equal opportunities to access the services that they need for optimal health and well-being. And especially this is true of children in poverty, and 1 in 5 of our children are in poverty. 1 in 3 are at risk for biomedical conditions and chronic conditions over the life course. They have family challenges, and over half are covered by Medicaid. And if you are a young child of color, you're more likely to be poor and then have the added burden of racism. If you are an immigrant child, you have the added burden of stress, of even worrying about deportation. And this is very, very important to acknowledge, because in 2010, 10 years ago, we didn't have all of the children counted in the census. And now we are here at 2020, another census, and we may encounter the same issue. These are significant issues that we can have do something about. And transformation is significant also to being part of the solution. We want to be able to shift from those social determinants of health that have a negative impact on child and child development, and also rectify inequities. There's so many unfair issues that are really imposed on families that they're not able to give young children what they need in having a normal, healthy trajectory over their life course. So it's essential. It's not a luxury. It is something we have to do to improve and make our child health care services connected to the community and additional resources, as well as more preventive, more developmental, and ecological. Next slide, please. So the who, what, where, when, and how of all of this, transformation is needed. We know that it's essential, and it's about the child health care system, and this is a rollout beginning at looking at the practice and the practitioners in the clinics as first responders. The practices can be changed to be more in line with 21st century challenges. When I was in training, the emphasis was on physical health. But today, in the 21st century, we know that it's much more than that. And we can transform practices to be more responsive to those social, economic types of influences, including even poverty. There are fundamental changes. And give you one example, some of the clinics now have full-time social workers on their staff. Some of our practices are aligning themselves with law and helping and assisting families who have had unfair practices levied on them that's having a negative outcome on housing, food insecurity, and where we want these types of transformed thinking in terms of our responsiveness to be diffused out and scaled up so that we have a new standard of care. And we want to do this now. And how we do it is through our collective advocacy. And that's where you play a very important role with us in seeing that this is accomplished. Next slide. I want to stress one thing here, and that is we know a lot. We know a lot. We know so much more than we've ever known, and we have science to back us up that more family-centered medical homes for children that engage parents and that emphasize healthy development. When we have, and we do have, the evidence that our healthiest kids are the ones that have more family-centered, high-functioning medical homes, and we need more of them. And we need more, and we have these practices that are, in fact, changing and transforming themselves to be more responsive based on some of these evidence-based models. And they're doing this by providing more team-based care, by looking at the health of relationships and family-centered primary and preventive and promotive services for young children. And it makes the difference. So we are transforming, and it should be universal. What we'd like to see a transformation not only in the practice, but how we measure the impact, how we finance, and how we approach the expanded view of, of a culture of health. Now, this is very complex, but it's also essential. We've got to do it, and we should. We have enough information to do this now, and with our collective advocacy, we can. And so now I want to turn it over to Charlie, who is our fearless leader and our tireless advocate for the framework for transformation of child health care. Charlie.
Well, thank you, Maxine. You made it a lot easier for me by giving that overview really in presentation. And that last slide, if we can simply get across those messages with ourselves and to others, I think we can really make great advances. I'm going to talk about a framework for transformation of child health care, really recognizing that we don't use the word transformation lightly. The transformation is much more than incremental adjustments to what we're doing today, that it's much more than the addition of an individual new program or practice or procedure. But it really is something that really lives up to that definition of child health care and the health practitioner's role in supporting healthy child development. We're very fortunate, I think, at being a point where we have enough information and evidence to move forward. And we also have, even within the field of pediatric practice, really directives to do so. The definition of a patient-centered medical home or a family-centered health home really does stress that holistic response through team-based care and partnering with the patient and the family to advance health and healthy development. The definition of health equity is really about improving the health and recognizing the need to rectify and not just eliminate issues around disadvantage caused by racism, or it could be sexism or classism, but to do something in a real context of ensuring that there is that opportunity for all children and their families to succeed and to not be marginalized, but to be valued. And we have in Bright Futures now, which is recognized under the Affordable Care Act as what should be the standard for well child care, a much broader description of what well child visits and child health practitioners can and should be doing with their children and their families. And it's a very ecological perspective that responds much beyond physical health issues to social and emotional development, ties and connections to community, and the unique needs and opportunities within children. So we're really talking about transformation as something being more than an incremental shift, but something that we have an opportunity to do. And I'm going to go through this presentation building upon the framework that our National Advisory Committee has established that really sets out this child health care transformation that defines it as being composed of four really interrelated elements. First, and I think we'll probably talk most about it, is the practice transformation itself. What the child health practitioners do from a primary and preventive through a treatment approach with the children and families that they serve. But that has to be looked at in the context of how we measure what we do, hold them accountable, and set goals and objectives for ourselves and define what our success is with respect to achieving that goal of child healthy development. And the third is then how we make sure that we are financing and resourcing the transformation so that we're not telling practitioners you have to do something more or different with less time or the same amount of time and adding to their workload, but really enabling that transformation to occur. And that really is undergirded in the broader culture of the transformation and the approaches and the mindset of practitioners in the field, in their work, doing this. And there we're really building a culture of health from the Robert Wood Johnson Foundation, because it really does speak to being more family driven and centered, more asset based and valuing, and more responsive to and tied into the need to rectify any inequities that do exist in the system. So we have a framework, and I think we've shared with most of you the one-page description, which had a lot more wordsmithing by our national advisory team than much of what we've done, because we wanted to be careful to be conveying what we're talking about very in ways that really get at the heart of what we need, and so that we're not allowing someone kind of easily say, yes, I'm doing this, if in fact that they're only doing a small aspect of it. So those are the definitions, and my presentation, the rest of it's really going to be going through each one of these 4 elements of child healthcare transformation, talking about the state of the field, about what we're doing and going forward, or in other words, where we are today and what we can do tomorrow. And I'm starting with the practice transformation state of the field. We are going to be having our actual second webinar specifically on practice transformation and what we know. And we're going to go into more depth than that on the actual work, but we conducted a state of the field review of different research syntheses which have worked to identify evidence-based models and exemplary practices that have come from within the child health care primary practice, or have been part of that, added on to that as an aspect, such as certain aspects of home visiting or parenting education and other 2-generation strategies, and done this state of the field review of exemplary practices. And frankly, I think found a huge array of efforts that are moving toward transformation, and that are doing so by restructuring and enhancing the office practice itself, how it's set up, what the receptionist does upon the patient coming in, with the mom coming in with her kid or the dad coming in with her kid, and through to what is gathered from the family, who talks to the family, how they're related to, and then what the practitioner does and what the follow-up is. That restructuring, enhancing the office practice itself, then incorporating an additional relational care coordination, which can take many names, from a family navigator to a care coordinator to a community health worker, to, as Maxine said, it could be a social worker who really begins to connect with the family and sees where the family is, how we can provide agency and support to the family so that they can support their child and the child's healthy development, and then linking to and often financing identified health-related services. And the term health-related really is broader than medical care services alone, and really does open up the opportunity for doing many 2-generation strategies. So on the right hand, and I'm not going to go over that, is the framework Kay and I developed when we reviewed Medicaid and young children and provided a source book of our own kind of connections of what a high-performing medical home really does in each of these contexts, the well child visit, the care coordination, and the other services. And what we have is we have these emerging practices, and not only that, but we have innovators within systems who have shown positive impact, and many of these have a pretty strong research base. And there's also been work and analysis that really has looked at the undergirding attributes or culture in which those operate that are key to their success. So the next slide, and this really is a preview for what we'll go into more depth on our second webinar, is we did a report where we looked at 5 different forms of meta-analyses from the field on programs that are evidence-based or promising or exemplary in this space of the Child Health Practitioner's Office, from Ariadne Labs, Einhorn Family Trust, and InCK, RAND, CSSP, the National Academies, and the Health Equity and Young Child Initiative. And what we discovered from reviewing those is that they'd identified over 50 evidence-based programs that had really demonstrated this impact upon child health and development, as well as a number of more systemic models which were within a health center, children's hospital, a clinic, that were often incorporating several different types of programs, often incorporating medical legal partnerships and healthy steps and a care coordinator to really achieve this healthcare transformation.
Charlie, you have great examples of that in your next slide.
Right. And from this, and this is again where the state of the field is, and we have a paper that really is a landscape of the activities, but there are now a number of multi-site and state diffusion efforts that are pushing out models and, in many instances, systemic responses that really do speak to this transformation. In terms of programs, like there are programs like Help Me Grow, Reach Out and Read, Healthy Steps, Dolce, Centering Healthcare, Triple P, and Home Visiting, all of which have been connected and linked to the practice in order to operate and really being incorporated within the health financing system. There are federal demonstrations and initiatives. We started the InCK model by really looking at the integrated care for kids, which the Federal Center for Medicare and Medicaid Innovation initiated. And there are now 7 states which have integrated care for kids models, 7-year projects underway with an InCK model. There are also this maternal opioid misuse initiative, which has 10 community models in states going forward, the State Innovation and Medicaid grants, ECCS project launch, and others. That there are an increasing array of federal demonstrations which are looking at least at major aspects of child healthcare transformation. And there are foundation initiatives, particularly in the birth to 3 space, which are doing so. Many of you may be familiar with Pediatrics Supporting Parents, which is an initiative which is multi-foundation, including the Packard Foundation, the Einhorn Family Trust, the Kellogg Foundation, and others, which is doing work specifically around young child healthcare transformation. The Pritzker's Children's Initiative, which is now working with over 20 states to advance prenatal to 3 child outcomes, looking at 3 interrelated, important components, one being child health, one being family support, and one being early education. And the Packard Georgetown Finish Line Project, which again has about 20 states and has been focused in a major way upon getting kids covered, but is now really moving toward also ensuring that the content and continuity of their care is advanced. And as mentioned, the Robert Wood Johnson Foundation not only is supporting InCK, but it's supporting two initiatives through the Center for Healthcare Strategies, which have multi-site demonstrations, or will have them. Right now, the Medicaid and early childhood is in operation with a number of states to advance work there. And the Accelerating Child Healthcare Transformation is soon going to launch an initiative with states and communities. So want to say that the state of the field is really that we have an increasing understanding of what constitutes high value and high performing medical homes and care, and that child health care transformation. We have an understanding of that. We have a lot of examples in place where that is moving forward, and we have an increasing array of initiatives and model diffusion efforts that are underway. So in terms of practice transformation going forward, I think, just to reiterate, we've really demonstrated the value of that transformation, and really in the diffusion of innovation literature, we've already enlisted early adopters and received recognition from leaders of the field. So the next steps are really much more broadly to diffuse and expand that. And then I think we have to recognize that this practice transformation has been limited by the absence of mainstream healthcare financing. Most of the initiatives and the exemplary practices that have been identified have been financed outside of the medical system through foundation grants or special grants, and not within the system. And we have not developed the metrics for use and quality assurance and development that really do emphasize what they are achieving. So in terms of where we are and where we need to go, is we really have the basis for saying we know that transformation is needed, and we have models where it is working and achieving much greater results than what the standard of care is. And now we have to broaden and deepen that and make the investments so we know enough to advocate and act. In terms of metrics transformation, I think that there is a tremendous amount of activity in the field in looking at how we measure children's health and healthy development, particularly in the early childhood space, how we measure how children are doing and whether they're ready for school. And the definition of school readiness is one that really gets at not only physical health, but cognitive development, social and emotional well-being. And we are looking at how we develop metrics that better define what we want to achieve with kids, and particularly young children. We're doing so at the practitioner level, at the system level, and at the population level. And where we are, and I think what we need to do to go forward is, first is we have to recognize that the current metrics and measurement tools that we do have in broad use in the health field are not yet aligned with that child health care practice transformation. Federal child health quality measures are pretty limited and focused mostly on physical health and medical conditions and needs. Electronic health records generally do not capture the type of information we would like to have in them, and the family histories and backgrounds. And there is a tremendous interest in the field for more measures, and people are moving out with trying to use ACEs, maternal depression, and ASQ in terms of new screens for and ways of assessing what we need to do with children and families, but they are really only touching upon the broader concerns. And yet we do have, and I think thanks to the National Survey of Children's Health, work in particularly in the Maternal and Child Health Bureau, and really the leadership in the Child and Adolescent Health Measurement Initiative, CAMI, we've really now developing tools which are doing a much better job of measuring and engaging and listing children and families. And that metrics transformation really means developing metrics that are asset-based, as well as identifying problems that really build upon and strengthen the agency and the support of parents and families in supporting their children's healthy development, and really look at much more than just what's going on with the child. And again, on the right-hand side, something that was developed with CAMI, a framework for young children, is that we know that child health is dependent, young child health is dependent upon many factors not related to the child's, what we measure specifically in the child. It relates to household material well-being. It relates to parent personal well-being. It relates to family social well-being and connections. And it relates to parent-child interactional well-being. And in each of those, there are ways to measure what's happening today and how we can build stronger supports for kids. And if we're able to achieve those in our metric system and advance those, we know that the long-term health of children is much better. So we have opportunities really to expand, but we need to build a metric system that is aligned with what the practice transformation achieves. In terms of finance transformation and the state of the field, I think that there are several things we know. The cost of doing nothing to improve child and health inequities is great for us. And that's one of the first slides that Maxine put forth of. We know what the problem and needs is.
Did that work?
The second is that we do have evidence on, and we know the importance and long-term value of investing in the earliest years of life. We know that getting started on a healthy trajectory has lifelong benefits. And we are understanding that the emerging payment incentives, which have been focused on the adult population and cost containment, really don't necessarily work well when we're talking about child health transformation. And what we are looking for in the early years is an investment-based approach, and really the kind of the emphasis that is coming now, talking about value-based payment systems, offers the potential, I think, for incenting transformed child health care. And doing so in particular because we recognize that high value care or high performing medical homes really need to be reimbursed for what they provide. And that's much above what we're currently doing in our standard of care, which has value, but is not achieving the goals we really want to achieve. So I think there's a real potential for having that emphasis upon an investment-based orientation. We also know that Medicaid is absolutely essential to this. Half or more of all young children rely on Medicaid. Fortunately, Medicaid's EPSDT benefit really can finance and is designed to finance that wider range of services to support optimal health and development. But most states are not covering that range of preventive and promotive care. And improving the health and development of children on Medicaid, because they are children who are most likely to be in poverty and struggling, most likely to have medical complexities as well as social complexities, it's really essential to improve health equity. So going forward on finance transformation. And our third webinar is actually going to be going into much more detail on this financing transformation, is the making the case that diffusing and accelerating this child health care transformation requires increased public investments, particularly by Medicaid. And it's not that kids are an expensive part of the Medicaid system. That's not where we have to try to achieve our cost savings and impact. This is the area where we have to make the investments. And that means having an orientation where, in many senses, value is volume. That the more we respond to social determinants of health, the more we really identify early and respond early to any signs of developmental delay, the better off we are. But that requires more work up front to yield those savings down the road, and that requires more investments. And in particular, it requires new investments in this high value, high performing medical homes. And doing all this really does involve building political understanding and will among policymakers so that they see that this is an opportunity. And policymakers certainly have seen that preschool is a need and an opportunity, and have been, over the last decade, really expanding preschool experiences because they recognize how important early childhood is. The same type of case needs to be made around young children and their developmental health. The fourth of the elements on this, and this will also be subject to a subsequent webinar, is really the cultural foundation for transformation. And I think we do have this recognition that this is approaching families and their kids differently. It is ecological. It is looking at children not from a medical side alone, but also from the context of their home environment and what their families want to do for them and what their families' hopes and fears are for them. And it's relational, that children and families must be partners in advancing health, and that it really has to be geared toward health equity. And again, I think this eliminating disparities, rectifying evidence of inequities, which can be that exclusion and marginalization due to race, immigration status, and the like. And again, this cultural foundation really is around the way the health practitioner, the receptionist, the nurse, the family navigator, and the health practice itself responds to the family and the community. And that cultural foundation, I think there's a growing consensus and understanding for this need. There's frankly this consensus that this applies for early care and education, for the school system, and for home visiting programs as well. But it also requires this type of transformation for the health practitioner and office. And the state of the field is we've really, I think, gotten a much better handle both on what are these attributes of effective practice, being family driven and relational and strength based. And we can really define that, observe where it is occurring in practice and where it needs more support, and even measuring it for its adherence. And I think that the state of the field is really an openness for doing this. And in all of this work, I also feel that the child health practice community wants to do these things. It's not a matter of saying you haven't been doing these because you don't like the kids and the families you're serving. It's been a matter of their time and their access to resources. But it really is something that is enriching when practitioners practice it and when they're given the time and space and resources to do so. So in culture transformation going forward, I really do think that and again embodied with that definition of child health. It's moving toward a culture of health, not medical cares. It's still recognizing that medical expertise remains critically important, but medical expertise is not the sole expertise the practitioner needs. Most practices can and will change to become high-performing medical homes. And it is complex and messy, but diffusion also is an implementation provides great opportunities for success and change, and people are sold by doing it because they see it works better for their children and families. So finally, I think one of the emphases of InCK is to say, we're going to get out the information that shows us what the state of the field is today and where we are today. And we don't have to start from scratch on any of these areas. In fact, we're positioned to take a big leap forward. And we can really achieve that collective impact and move toward transformation if we do engage in collective advocacy. And we must tell and reinforce this compelling story, educating our colleagues about the consensus we have, and we must promote and encourage others who are in areas of policy influence and activity and investment to make those changes. I want to go to just the last slide because that I have, and it really relates to the kind of theory of change that the InCK model is taking. And I use the terms collective advocacy for collective impact. We also need to have more integrated systems, but we simply need to also push for what we know works and advance practice within the child health care system, even as we work to ensure that other systems also are enhanced and transformed, and our interrelations are, and that therefore really we are part of a group, and certainly a critical mass of individuals and leaders that can help, that can produce these changes in the health practice world. And frankly, no one else is probably going to do this for us. And we can find our own areas of influence where we can contribute to the transformation. And we hope to be part of this work with you and have our resources available to you as you do your work. It is complex, but there's always an opportunity in your space of influence and work to add value and to make some of those forward movements that will help to get us to that child healthcare transformation.
Thank you very much, Charlie. Thank you, Charlie. That was a lot of content, and I know people were really taking that in. We had left a little time here. I just want to say, if people have additional questions and you didn't want to chat in while Charlie was speaking because you were really focused on that, but I will say, Charlie, there's been some lively exchange in the chat while you were talking, and I want to pick up a few of those themes. One is around family engagement, and I think very importantly, a number of people, Diana Auden and others, really talking about making sure about the visibility of family engagement, making it authentic, being specific about what we mean, and knowing and understanding what we mean. I did say I believe that's going to be picked up in a couple of the upcoming webinars, starting with the next one on practice. There were also issues raised about the fact that Medicaid is not always paying enough to even get the job done today. And as you well know, Charlie, that's the reason that this InCK framework really has that finance element there, because too often people talk about practice transformation either in terms of value-based care, where they think they can pay less for some things, or in terms of just changing the practice and putting more burden on providers. And that ties right into the issue of measurement, of course, the old adage from CDC about what gets measured gets done, and thinking about measurement at all of those levels. We had some exchange about, measurement linking to engagement, the importance of asking questions in ways that are respectful of families and in contexts where families can trust that if they give meaningful answers and describe what's going on with them, that is in the context of trust and responsive systems. And I think the other theme that was raised is about how we can be more effective together. And as you were rightly saying, having effective advocacy for change and transformation that combines the practitioner champions, the experts of other kinds who do research, and the experience and stories, lived experience of families from across a wide array. I am not seeing a lot of other new comments in the chat box, and I hope I've been respectful to the comments that you put in while Charlie was talking. I would just say, we know enough to act is the message that Maxine started us with and that Charlie tried to reinforce. And again, that there are roles for each of you, again, whether you're in practice, in a health department, in an academic setting, in an organization concerned with child health, or a parent who is thinking about your advocacy role on behalf of your child or on behalf of groups of children, becoming active with us in child health transformation, and as well as in work in your states and communities. And as Maxine said, a lot of transformation is going on now. I did virtual Hill visits with some people yesterday who were talking about Medicaid and children, and reminding them that as we're making any big sweeping changes to our healthcare system right now, we have to be mindful that those changes don't have negative impact on child health. Another way that you can interact with this process and advance this is to use your expertise, whether it's research, data, practice, program, policy, or direct advocacy, and bringing your voice to this. Speaking, writing, raising the issue with your colleagues about the readiness for transforming practice and the importance of both a transformation as well as supportive metrics, both at the practice level and the systems level, and of course of the financing. We hope that people will be advocating for policies at the federal and state level, for investments that are both public and private, for systems development and community level strategies, and to be a part of a learning community with us and sharing experiences. I would just say there was a very important comment about when, Charlie, you were describing all of those initiatives, about the need for there to be more coordination. And I know that's something that Charlie and I and others have worked on, to have both the funders and the organizations who receive funding to lead those initiatives be in communication with one another and talk about this in a more collective way, so that we aren't taking a lot of different messages to states and communities about what needs to change. I would just close by saying we have upcoming webinars and working papers. We've talked about the overview of this transformation framework and ideas today. In April, on the 23rd of April at 2 o'clock, that Thursday, fourth Thursday of the month, we are going to go deeper into practice transformation and to have some expertise from leaders who are thinking about practice transformation, talking to you at that time. In May, we'll be talking more about the finance aspects of this. In June, Christina Bethel and others will join us to talk about metrics and measurement transformation. In July, about culture transformation, and really, again, come back strongly to the equity theme there, although it will be woven throughout the framework and all of these conversations. And then in August, about specific policy transformation, The website is incmarks.org. There's a glossary, there are documents, an array of documents that were prepared last year, and there will be a number of links to documents from this year. A question people already have at this time is, will the webinar be archived? It was recorded, it will be archived. There will be a link to share with you. It will both be at the website, and we will also send it out to those who were enrolled. And the issue there of figuring out how you can help us go forward. I'm going to take one last thought from the chat box about culture transformation in the overlapping circles. Nope, Coddlechuck, it's the big circle behind the Venn diagram, and it is there. It is grounding the work, both in the thinking of the Robert Wood Johnson Foundation about the culture of health, but also about changing the culture of practice and being respectful for family culture as we go through transformation. So it's represented in 3 different ways, and obviously driving political will based on the model of change that you shared with us all many decades ago is very important. So with that, and 1 minute to spare in your day, I thank you all very much and appreciate having you on this webinar today. Thanks again.